Bachelor of Medicine and Surgery, MBBS, Master and Medical Degree of Intensive Care and Anesthesia, Master of Total Quality Management, Nutrition Diploma for American Fitness Professionals and Associates AFPA, Diploma of Law and Police Science, worked as an officer doctor in the Egyptian Ministry of Interior till 2015, then moved to Kuwait to work in Dar al-Shifa till now.
And we're back with you, dear viewers, and today, as a Bachelor of Medicine and Surgery, MBBS, and Masters and MD of Intensive Care and Anesthesia. He has Masters of Total Quality Management, Nutrition Diploma from American Fitness Professionals and Associates AFPA, a Diploma of Law and Police Science, worked as an officer doctor in the Egyptian Ministry of Interior till 2015. Then he moved to Kuwait to work in one of the greatest private hospitals here till now. So how about we welcome with great pleasure Dr. Haytham Al-Aboudi, an anesthesiologist. There's a lot of anesthetics in it, and intensive care specialist. Good morning, doctor, and can you tell me that word that I didn't know how to pronounce?
Yeah, good morning. It's actually a difficult word, even for doctors. It's anesthesiologist.
Anesthesiologist.
It's anesthesia.
Okay.
And then you put less, so anesthesiologist. It's quite difficult, I know.
Well, yeah. Well, sometimes we cannot really pronounce all that heavy duty words, but I know that your work is a very crucial nowadays. In the past, people didn't have any anesthesias.
That's true.
And the surgeries were done without anything to calm people, or let's say the patient down. They would give them anything that they can, and I remember reading about it, and like in the 1700 they used to put a stick in between the teeth.
So they can tolerate the pain.
So they can tolerate the pain.
Yeah, that's true.
This shift nowadays, we are like shifting from a stick to something totally excellent and totally nice and really safeguard. Tell us about it.
Yeah, actually surgeries couldn't develop until they started developing the anesthesia, because before they started the anesthesia, most surgeries were like minor. The risk of complications or death due to the pain was very high. So even surgeons, they know that actually they owe anesthesia to have like the huge development and revolution in surgery. Anesthesia actually started way early, maybe like 8,000 years ago.
Yes.
Pharaohs used medications. They did actually surgeries under the effect of anesthesia, but the actual development of anesthesia in the new medicine started like 1850.
Yes.
Something like this.
Yes, that's what. No, 1900.
They started using something called ether. It's an inhalational gas, but still the risk of complication was high due to the technology. Nowadays, anesthesia changed dramatically. So
this is the let's say this is the bliss of modern.
That's actually a bliss. Even if you don't need a surgery, even if you are giving like delivery, normal delivery. So why would you tolerate the pain if you can just subside it?
This is what we all everything. We don't want to tolerate anything. That's it. Exactly. So I know there are stages in the
That's
anesthetic.
true.
We whenever we want to do something, or we go to the doctor for any like complications, or he wants to investigate something, he always says you have to meet with the anesthetic doctor. So tell us about those stages.
Okay, so you want to talk about the visit before the surgery itself. It's called preoperative assessment.
Okay.
Actually, till now, many hospitals don't do this, which is actually not the best thing to do. Okay, because you have to see the anesthesiologist a couple of days before the surgery. He will ask you about your history, your drug history, like if you have allergy for anything, if you have a medical condition, because anesthesia is different from one patient to the other. You don't give the same medications, the same doses, the same even maintenance to the same patient. You deal with each case individually. And then he explains to you. He explains to you what you will experience, what to do, if you have any doubt, and so on. This will create like a bond between you and the anesthesiologist. It's called doctor-patient relationship. Once you have a trust in the anesthesiologist, the whole experience gets better. You have less anxiety, less tension before the surgery. During the surgery, you know the guy next to you. You trust him. You know that he will take care of you.
Yes.
Even they say that on the psychological level, even on the long term after the surgery, when you have a connection with the anesthesiologist, you have less incidence of nightmares or psychological stress after surgery.
So this really happens.
This is all, it's all documented. It's like medicine. It's not, So one of the issues also is that you can, me as an anesthesiologist, I can know many information from the data in front of me, but without taking a history from a patient, many things I can miss, which can dramatically affect the patient health. So
just a question out of nowhere, I wanted to ask it.
Sure.
Does coffee really get in the way or affect the anesthesia at the time?
Okay, so
I've been always wanted to ask this question.
Everyone thinks that, they always tell me that they get lots of coffee. Will this affect or no? Okay.
Yes.
To be honest, any central nervous system stimulant like coffee may affect the doses of anesthesia, but because the medication that we are using are very powerful, so we don't see this. We can see it in different, we can see it with chronic alcohol use or chronic drugs or something like this. We need more anesthesia. But the coffee, I don't think it will affect that much.
Well, this is a relief, and this is very good.
You can drink coffee as much as you want. Just don't exceed 500 or 600 milligrams per day.
This is good. This is very good news. This is for all of us.
Like 5 cups a day. That's your maximum, including all the chocolate, all the caffeine, like chocolate, coffee, or whatever.
Okay, that's not a very good news. News are not very
coffee
good.
Actually is very helpful. It's very good for the health. But if you exceeded the coffee intake, that's when you'll get.
So I think 5 cups a day. Well, in a couple of weeks, because I'm not allowed to have it nowadays. So, doctor, I know that there are so many types, and I remember one time I have asked my my anesthetic doctor to give me one of those anesthesias to take home with me, because it's like shutting down and opening my eyes again in no time. But I know it's not like that. So what are the differences between these anesthetic? What are their differences?
Like, we have different types of anesthesia, but if you want to categorize them based on the part that we anesthetize, we can start with the local anesthesia. We give anesthesia to a small part of the body, and the patient is fully awake, but he doesn't feel the surgery in this area.
Oh, okay. So this is a partial anesthesia.
Yeah, it's partial anesthesia actually. It's the local anesthesia. And if you got wider, there is also another part of partial anesthesia. It's called regional anesthesia. When we give anesthesia to a region in the body, like one arm, one leg, something like even the half anesthesia that we give to the cesarean section or normal deliveries, it's called regional anesthesia.
So let me just emphasize on this one. The regional is different than the local, right? Okay.
True.
So the local, first of all, is for just a small part.
That's true. Small part of the body. It doesn't include like one limb, like whole.
Okay,
part.
or organs, just a small. Then the regional anesthesia, yes.
And in the regional, as we said, you can give part of the body or half of the body. And when you move forward to the general anesthesia, when we call it like knock the patient out, we put him to sleep. He experienced what you did. The anesthesia medications makes you very happy, very relaxed. Actually, I'm not sure if I should say this information, but the risk of addiction among doctors.
Yes, this is what I wanted to ask.
The risk of addiction among doctors, not just patients, among doctors also are the highest among anesthesiologists. Due to 2 actually factors, like they have chronic stress. Anesthesia is one of the most stressful specialties in medicine. Plus they have access to drugs. They can get it. They see the effect on patients. So some doctors
take it easy,
and patients also. That's why we always try to stay away from drugs that the reputation that of these drugs that they have high addictive index or something.
Ah,
So we
okay.
stay away from them. Yeah, we want the patient to be happy, but we don't want them to be
not all the
addicted.
time.
Yeah, it's
Not
true.
all the time. They want
That's true.
you want the patient to be happy.
But
Actually,
yeah,
not all
during
the time.
the surgery.
So-
So general anesthesia,
Yes.
right? In the general anesthesia, we don't put the patient to sleep. We don't make the patient asleep, actually.
What-
Anesthesia is different from sleeping, because if you are asleep, you can wake up, right?
Yes.
If I talk to you, you will wake up. Anesthesia is more close to coma.
Okay.
But yeah, it's true. It's a coma, actually.
Uh-huh.
But it is induced coma because we induce it. We do it with drugs, and it is controlled because we have a control on it. We decide when to stop it, how to stop it, and so on.
Wow.
Yeah.
So this is really big, because
It
when
is
you
big.
when we say we are sleeping or we are nothing, this is very easy and very nice. But when you put it into like it's an induced coma, that's a big issue.
It is.
Because we
It
cannot really comprehend that we are in a coma and we might not wake up after that sometimes, right? Yeah, I want to go there.
Yeah,
Yeah, I want to go
that's,
there. I know that. I want to know what the patient would expect before and after. You tell them that, but sometimes there are, let's say, sequences about those.
True.
Yeah, tell us
Okay,
about
so
that.
you want to talk about the sequence during the general anesthesia itself, or
Yes,
starting
let's
from before?
take it step by
Okay,
step.
for
Procedures.
my patients taking general anesthesia, I prefer to start early from even the floor, just before even they come to the OT.
Okay.
I talk to them, I give them medication that makes them relax, anxiolytic, because some patients will be anxious, and this will differ from one person to the other.
Yeah.
So I like to give them an anxiolytic medication to make them relax. I accompany them to the operation theater. I don't just leave them to come with the nurses.
Yeah, okay.
I come with them. I start the anesthesia, and I like to give them a nice mood before they sleep, because if we slept happy,
Yes.
we wake up happy, right?
That's so true.
So if you make him relaxed and happy before the anesthesia, you don't just knock him out in a couple of seconds. No, you make him relaxed, happy, and then you go smoothly into the anesthesia. We have 3 main stages of anesthesia. The induction, like starting the anesthesia,
Okay.
and then the maintenance, how to keep the patient continuously under the effect of anesthesia, and then how to wake him up.
The awakening.
Yeah, because there is a very wrong information. I think you heard about the extra shot of anesthesia.
Yeah.
There's nothing called, like, we don't give anesthesia as one shot and that's it.
Okay.
Yeah, we
So
give
it's
something
gradually.
It's gradual and continuous.
Okay.
Once I stop the medication, the patient will wake up.
So if we were to put it in a chart, it would be like exhalating, then having to a point, and then
True.
getting down, right?
Exactly. Yeah, you go to the peak, the therapeutic level, and then you
Yes.
go to the maintenance, which is the plateau, and then you go down slowly.
Okay.
Actually, the job of the anesthesiologist is not to give the anesthesia alone. We know how to give the anesthesia, how to put the patient down in a couple of months during our residency. But we stayed the 5 years
Yes.
studying how to deal with the complications, how to deal with different diseases of the body, because you as an anesthesiologist have a full control on the human body, starting from all the organs till you reach the cells. So you have very precise control on the body.
Yes.
And you know that the human body is quite complicated. It's difficult to
Yeah.
control it, right? Yeah, so that's we have a term called balanced anesthesia.
Yes.
How to give general anesthesia, which is balanced. We have 4 aspects that we need to consider.
Okay.
The first thing is to put him sleep. We need to make him not aware, right? It's
Yes.
called hypnosis. And we have another thing, that if you are sleeping and I pricked you, you'll feel the pain, right?
That's what-
I don't want you to feel the pain.
Yes.
So I have to give you analgesia, like very strong painkillers. Like cocaine, morphine, stuff like this.
Okay.
Okay. That's why anesthesia is
It's
quite
addicted,
crucial.
yes.
Yeah. And you can move. You can turn around. Like you can move in bed, right?
Yes.
I don't want you to move while I'm doing a surgery,
So-
so I have to give you something called muscle relaxant. It causes paralysis of the muscles.
Yes.
Which is quite risky if you don't have to control the patient, because the patient cannot take his breath anymore.
Yes.
You have to put him on ventilation and give him breathing. And the last thing is called amnesia. I don't want you to remember. Yes, you can be sleeping, but you can recall. You can remember. You can listen. You can have nightmares. You can
Yes.
have psychological issues after. So I have to give you medication that makes you forget amnesia.
Okay.
Yeah. So
For-
sleep, don't move, don't feel, and then don't remember.
Forget.
Yeah.
Well, those are really a great
Yeah.
4 factors. And that's why we don't remember the pain. We don't remember anything during that time of the surgery. Before the air, our producer said that intensive care and ICU, that's the intensive
that's
care
true.
units, and
That's
anesthetic are hand in hand together.
That's
How is
true.
that?
Well, The intensive care is the unit that you deal with the very critical cases that other specialties cannot tolerate. There is life-threatening conditions that you have to deal with them.
Okay.
In most countries, including Kuwait, the anesthesia doctor is the same doctor who is in the intensive care. You receive the patient based on his is a surgery or medical condition, and you have to support. You support the heart, you support the lung, you support everything.
Okay.
Trying to keep him alive. So it's the same doctor. People will go to the intensive care, but they don't know who is this doctor. Yeah, this is the anesthesia doctor.
Okay.
You take care of the patient, you save his life. You know, do you see this movies and Grey's Anatomy and stuff like this?
Yes,
you see that the patient is dying, they do the CPR, they resuscitate him. This is actually the work of anesthesia or intensive care.
The resuscitations again and all of
yeah,
that.
there's like
right?
a team.
The CPR and
Yeah, this is a team. The head of the team is the anesthesia doctor.
Okay.
Yeah. So I hope we can make a difference in patient lives. Yeah, I hope.
Well, I bet that you are doing a great job and a great difference in our lives, because
Thank you.
I know, Dr. Haytham, that no matter what we can say or what we can do, it's a team, and you are just a part of a big and a great team that really works for our health as well. Well, let's say a little bit of amnesia wouldn't go amiss. That's so good that we are really forgetting all of those hardship. Dr. Haytham, we are really happy that you were here with us, answered my questions, especially the ones that I wanted to ask, and especially was those like, can I take an anesthetic at home? And I think that's as those 4 stages, it's a nut, and we can really...
If you can, I would take it home, actually.
So, no, we don't want that.
We don't want this.
Thank you very much for being here.
Thank you. That's my pleasure. Thank you.
So a great thanks to our guest, Dr. Haytham El-Aboudi, anesthesiologist and intensivist, and a quick break so we can really digest all of those science information.